listening to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience. The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and today we are talking about empowering connections that lead to healthier outcomes. To do that, we have a special guest, and her name is Lynette Glockner, pharmacist and owner at Matthews Pharmacy, serving Matthews, Virginia. Lynette has dedicated the majority of her career to serving patients in Matthews, Virginia. She earned her Bachelor of Science from Ohio Northern University in 1996. She is married to her husband, John, and has 3 children, Brianna, Kaylin, and Austin. In her off time, she enjoys reading and speech. So welcome to the show, Lynette.
Thank you. How are you?
Doing well. I got to ask, can you recommend any good books lately that you read?
Honestly, I have not had time to read much in the last year. I do like Karen Kingsbury, David Baldacci, Dora Roberts. Those are a couple of my favorites.
All right, noted. I'll see if I can maybe. I've kind of been reading more and more in the last year, so it'll be interesting to get into maybe a couple of those books that I always like to ask people, just because I'm always looking for different stuff to read. So thanks for the recommends.
Yeah. Yeah, it depends on what you like to read, but.
Yeah, for sure. Yeah, I think I'm over the Harry Potter books. We'll.
Those were never my thing.
So let's go back to the beginning, Lynette. Let's talk a little bit about how you got into pharmacy, why you got into pharmacy. Kind of take us through a little bit of that abbreviated story.
Okay. I guess back in high school, I knew I wanted to do something in the medical field. I was good with math and science, and everything kind of led towards that direction. I had been dating my husband at the time for about 6 years before we got married. So we dated through high school and knew that I wanted to just get married and have kids, and I could care less about a career. But at the time, you could get your Bachelor's of Science or you could get your PharmD. And, I had no interest in being a hospital, manager or anything like that. So I just stuck with the Bachelor of Science and got out in 5 years. And we had been married after my 3rd year. We got married after he finished college, and I worked for Refco from my senior year in high school as a cashier all the way up through technician, intern, extern, and then pharmacist. Mm-hmm. They got bought out by CVS the year that I had my first child, Brianna, and moved to Virginia in 2004. Stayed with CVS in Williamsburg, Virginia. We lived there for about 4 years, worked in Williamsburg for a couple years, moved to the Callori store, which was about an hour and 15-minute drive one way on top of 12-hour days and every other weekend. And that, it's Friday, Saturday, Sundays, had to work holidays, all that nonsense. Found out there was a pharmacist in Matthews, Virginia, that had been looking for a pharmacist, a full-time pharmacist, for about a year. Hadn't found anybody, because literally if you come to Matthews, Virginia, the only way back out is the way you came. There's pretty much two roads into Matthews, and if you keep going, you end up into the Chesapeake Bay or one of the rivers that go into it. And the funny thing is when we moved to Gloucester, Virginia in 2008, Matthews is only like 20 minutes from our house at the time, and I turned left if I would have went straight, I would have been in Matthews. If I turned left, I went to my CVS in Kilmarnock. And I was like, where in the heck is Matthews? She's like, you live right by it, the lady that was telling me about it. And I was like, oh, never went straight, I spent all of my time working and then, days off that I did have, I, was cooking and cleaning and doing stuff with the kids and their sports. And so I decided to go work for an independent. We hit it off real well, and, it changed my lifestyle completely, going to, instead of 9 to 9 shifts to 9 to 6 through the week and 9 to 1 on Saturdays and closed on Sundays. I was like, oh my gosh, I can go to church every Sunday. This is crazy. Never even knew that this kind of lifestyle existed because, I'd always been with the same chain for 18 years.
Yep.
And
yep.
I was able to, go home and cook dinner at night. I was able to be there for my kids' sports events and things like that. Closed on holidays. I'm like, what in the world? I don't have to work Christmas ever again. And so I started with her in 2009 and never had any inclination of owning a pharmacy. And, my husband's like, you need to talk to her about buying the pharmacy from her when she's ready to retire. I said, no, I don't want to do what she does. She works hard. She's, goes in early and stays late and, all that nonsense. And then time came, 2018, she approached me and said, we're ready to retire. Her and her husband ran it. She was the pharmacist and owner, and he kind of was like the co-owner, glorified cashier, maintenance man, I kind of started thinking seriously. I'm like, okay, if I don't buy the pharmacy, then I've got to go find another job or hope that whoever she does sell to, wants to keep me on staff. And and so I was like, okay, can I do this? And so I prayed about it and said, yep, I can do this. So other than anything tax related, I've learned on the fly.
Let's get into that a little bit. So,
okay.
So you said 2018. Now 2018, as
Yep.
we know, is those are the COVID years. The beginning. I mean,
prior to,
yeah, a little bit prior to.
I had like 1.5 years prior to COVID. Yeah.
Okay, so that first year, that first 1.5 years, and leading into COVID, what were some of the biggest challenges you were facing?
Well, the biggest challenge is when I first bought the pharmacy. As you know, PBMs pay anywhere from 30 days to 90 days to 120 days.
Yep.
Later.
Yep.
So everything I had coming in went to her. From September until pretty much January into February, I was writing checks once a week to her.
Okay.
And finally the checks started to get smaller and smaller, but those big checks from Caremark and Express Scripts didn't go into my bank account. I started off with what they recommended, and within 1.5 years, I was literally thinking I was going to go bankrupt. And then COVID hit. So that was truly my first challenge because for about 3 to 6 months, I think it was, I was having to call Cardinal and say, hey, I need 4 more days to pay my bill, 5 more days to pay my bill. And I had joined PDS in 2019, I think it was.
Mm-hmm.
And the first year I didn't get much out of it. And after that, I got a different coach, and things started to change, and just kind of learned a little bit more of how to make money, working with Kristen at Outcomes, and just, like I said, learning on the fly the whole entire time.
Yeah. So
still to this day, learning as I go.
So you mentioned Outcomes. What changes and what did Outcomes give you as far from a new business owner, and as you were learning on the fly, as you said, mm-hmm. Outcomes really tries to connect all the different tools that a pharmacist needs. What were those? How was it implementing that, and what do you feel like you got out of that straight off the bat?
Well, honestly, I don't do much with it. I have a lead technician who deals with Kristen every 2 weeks.
Okay.
But it was just a matter of learning. Okay, we're pretty much a 3 or 4-star pharmacy, on all the EQUIPP scores and all that. And it was, okay, how can we improve our scores? Because if you improve your scores, then you can improve your payments. And the less DIR fees that they take back. And so she just, created ways of doing that, as well as, hey, you're losing money. She'd call us and say, you're losing money on this Advair brand. Is there a way that, the insurance will pay for generic, or maybe not necessarily Advair, but something new would come out with a generic that we wouldn't know came out. Or we'd be filling for a generic. And she's like, you know what? If you call the doctor and get a DAW on that Concerta, insurance pays and you don't take a loss. So just learning different, really, making sure your DAW codes are correct, whether it's a 1209, whatever the case may be. Things like that helped. That made a big difference. Having the technicians, work on tips, having my other pharmacist who works part-time, she would work on the CMRs, things that I don't have time to do. And that's been the nice part, is it doesn't have to be the owner that does these things. They work with, whoever they need to work with at your store that's, capable of working with them.
So how often do you think you're in touch with the pharmacy advisor? I mean, when you're talking about, mitigating risk of DIR fees, saving time, maximizing reimbursements. I mean, I feel like I'd be on the phone every day, making sure I'm, getting all the right info.
Nope. So once a week, she sends Pam, my technician, a report, and she has a week to look at that report. And the next week they have a phone call. So every other week she's looking at a report. Every other week she's having a phone call, and the phone call is anywhere from 5 minutes, like, I have got nothing for you, y'all are doing great, to, hey, you need to work on this, 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 and this, and your scores, and we've been doing really well since that. And that's been probably about a year and a half.
Now you get to look at, through the platform, you get to look at a dashboard, correct? Now that dashboard, when you're taking a look at it, have you seen increased patient adherence, better outcomes since this has all been implemented?
Yes, all of that. We were at 4 and 5 stars consistently throughout COVID up until maybe just a couple months ago, and we're still at 4 stars. But that's just because, sometimes you are too busy, or you have sicknesses, or you have whatever the case may be, and you don't have time to work on, certain things. But, for the most part, we've stayed consistent with what we need to do.
So how is all this, getting all this information, each and every week, how has it changed the way you run or even manage the pharmacy? Or has it changed the whole team dynamic, in the pharmacy?
I think with Pam and Diana working on the tips and the CMRs, I've gotten another technician more involved in inventory management. It's just, there's certain technicians who are, say, great at customer service. There's certain technicians who are great at just standing there and filling prescriptions, which you still need to have those technicians. There's certain technicians who are great at the productivity aspect of it. And you just learn to put your technicians that you do manage where they are best suited.
Have there been any
the pharmacy run a lot smoother?
Oh, for sure. I mean, so now that you're an owner, and I would imagine you've had a lot of ideas, and you even said yourself, and you might have a little bit more time just for yourself. I mean, are you finding yourself with all this information, implementing new programs and new ideas into the pharmacy?
Maybe not. I'm not very creative, so maybe not new. But I think just following the advice that is given to us, getting all whoever's at data entry, getting them to pay attention to the DAW codes, or, hey, this man qualifies for a blood pressure check, just little things that just add up that you would never think to do unless somebody said, hey, do you know you can get paid for this?
So, I mean, are you noticing like a full healthcare journey difference, healthcare, just everything?
Starting to, yeah.
Yeah, starting to, just for your patients in the community, are they noticing it too from, ever since the changeover happened? I
think so. Everybody, tells me that they love my staff. They love everything. So, they're always so appreciative that we're there. We have a very close-knit pharmacy family that work there. Everybody has been there for longer than me, as long as me, or since I took over. I hired a couple people just because, we're increasing business every day. We're, taking prescriptions from Rite Aid. We're, people are finding out that, oh, I don't have to go to Walmart. No, you don't have to go to Walmart, which is 20 miles away. You can come to your local pharmacy, and they realize that, oh, I can actually talk to you. I don't have to wait 45 minutes to speak to that pharmacist that's behind, the Walmart counter or
exactly.
CVS or
Yeah.
whatever.
Yeah, totally. That's
they
always
come in and they get the, hey, Mr. So-and-so, hey, Mrs. Jones, they get that personalized attention and they enjoy that.
So the whole ecosystem around outcomes and what it brings to the pharmacy, are you planning on using any more of these tools in the future?
I will use whatever Kristen and Pam come up with that will help increase revenue, decrease loss. Like I said, I don't do much with it. I'm probably not the best person to be on this conversation with you. It's probably my lead tech, Pam, because seriously, she's like, hey, Lynette, I'm going to do this. Okay. She takes it and runs with it. So.
Well, give me an example here, because I always like to hear, stories, especially from pharmacists. Do you have an example of maybe the program, changing something completely for a pharmacist, or, giving you a little bit more insight on how to help a specific patient that was maybe struggling with something or something that was caught? Any stories you could think of?
Learning that I qualified for rural rate contracts. That was a huge change. That was literally right when COVID hit. And that decreased my DIR fees big time because there are no other pharmacies within 15, 20 miles of me.
Oh, well, explain that a bit. I haven't heard of that. What is that exactly?
Okay. Rural rate contract is if there is no pharmacy within 15 miles of your establishment, you qualify for basically this contract that they don't take out any or as much DIR fees. So my DIR fees went from probably $70-some thousand to about 15 to 19,000. It eliminated pretty much Caremark and Express Scripts almost completely. Humana and Optimi didn't qualify for whatever reason. Maybe their standards were a little bit different. It's, one way is GPS, one way is as the crow flies or something. So it just depends on their qualifications if you qualify or not. But that was a huge difference. It's just a different contract. I couldn't go with my LeaderNet contract with them. I had to go and get a contract with those PBMs on my own. So that's been a game changer.
I feel like there's a bunch of pharmacists right now trying to find out if there's any pharmacists within 15 miles of their store right now.
If they have a Walgreens across the street, they won't qualify. But if they are in literally our county is probably 45-mile radius. There's probably 8,000 to 9,000 people in the county, but there's like these little suburbs, if you will, of Matthews County. There's Matthews towns. So like my mailing address is Matthews, Virginia, but I live in Port Haywood, Virginia. So it's kind of like a little, but it's the whole county is, probably about a 45-mile. And like I said, every aspect of it touches water. So a lot of older community, we have a lot of older clientele, that they don't leave the county at all. We've got the grocery store, we've got the bank, we've got the post office, and we've got the hardware store and a few restaurants. And they don't leave out of that area. They're not comfortable driving it. The closest CVSs are like 40 miles away or more. So that helps with the CVS people who, have to use mail order or have to go to a CVS. Sometimes they can opt out of that to be able to use my pharmacy. That's helped, explaining that to them. So yeah, if you can qualify for that, that's a game changer.
No, that's real. I've never heard that, and I think that's pretty amazing. That's a pretty amazing opportunity for most folks. Again, I'm not a pharmacist,
Yeah.
but to kind of give you that type of a discount and that little bit of an easement is kind of nice.
Yeah.
As from a patient perspective, what is any fun story? Now we talk about outcomes, we talk about adherence, and how important that is to keep your star ratings up, um, and in talking to different patients and making that connection with them. What kind of you have any fun patient stories that you'd want to share about maybe somebody getting a little bit more adherent? I remember last time someone was on the show, we talked a little bit about someone coming in and their obviously their daughter was was an elderly patient or an older patient, and the daughter and the son were coming in and trying to really push the getting into doing some sort of prepackaged prescription program. Yep. And how
I
much easier.
I have a story just about that.
Hit me with it. What do you got?
I have a patient who doesn't have family. She has a friend lady who helps take care of her, takes her to the grocery store, brings her to the pharmacy to get her meds, and she was all messed up on her medications, wasn't taking the right ones at the right times. And she said, can you do, unit dose packaging? I have not delved into it much because I was like, okay, do I have the need versus the cost? So we literally just had her purchase 5. She takes almost everything once a day, mm-hmm. and they can all be taken together. So we just did the single weekly pill boxes. She bought 5 of those boxes, and we write week 1 in marker on one box, week 2, week 3, week 4, week 5, and she knows when she's on week 5 to bring her 4 back. We've med synced all her medications so that we work on those 4 weeks boxes, and by the time she's at the end of the week, she's got her 4 weeks back. It's been great.
Wow, I always love to hear that.
That's only been going on for probably 3 or 4 months. And her caregiver has come back and she said she is on track with everything since you guys did that. And they're just, very appreciative. Stuff that you only get from an independent pharmacy.
Absolutely. Yeah. See, this is why I like to hear these stories. Yeah, this is why I like to hear these stories. It's more personal. You get to have that connection for sure.
Yeah, I'm starting to get more people asking about unit dose packaging. So I'm looking into my options.
As it comes to from a workflow perspective, how has it also helped the pharmacy?
Like I said, having everybody focus on, say DAW codes and working on MedSync, patient adherence, different, offering immunizations, just because you get paid to do that. Everybody in the habit.
Did COVID kind of, interject more of an immunization program into the pharmacy, or were you guys already doing that?
Yes.
Yeah, you were. Okay.
We pretty much, we have always done flu. We've done back in the day Zostavax and now Shingrix. Shingrix wasn't available for practically a year, but it seems like once COVID hit, the doctors were focusing more on the pneumonia, the flu, the Shingrix, getting everybody. And so now we can, my lead technician, Pam, who does the stuff, she does our immunizations for the COVID. And, she's brought in new customers. People that have never even heard of us would come there because they could get a vaccine. And, back when COVID first started, and, they're like, oh, you guys aren't as far as I thought you were. And, just her friendly nature would bring in new customers.
Wow. Okay. Yeah, I love that.
And of course, when you're now, hey, you're getting your COVID. Have you had your flu shot? Have you had your Shingrix series? Things like that. Mm-hmm. And, if you have any questions, talk to your doctor, that kind of thing. So that's increased that revenue as well.
So as far as, what that outcomes platform brings and, what you've experienced in opening a new store, a few years ago, what's some big pieces of advice that you would give to maybe someone thinking maybe if you were trying to give your advice back to yourself when you were kind of teetering on, do I want to buy this pharmacy or not? What would you say to yourself back then?
I would say take any resource that is offered to you, at least to check it out. The other pharmacist that owned before me, she never dealt with the EQUIPP and the outcomes, and it was what it was, and I don't have time to deal with everything else. And you find if you make time for one little thing, it turns into a big thing. So you just never know where it's going to take you.
Yeah, and I believe Outcomes also has a premium suite of products that will be available soon. But I do want to thank Lynette for joining us on the show today, providing her experience. Again, we all know how valuable the time of an independent pharmacist can be. So Lynette, I really want to say thanks to you.
Well, thank you. Thank you for asking me.
And thanks to the listeners and all the independent pharmacists out there for keeping us all healthy. If it's your first time listening, be sure to subscribe to the podcast. And we look forward to seeing you next time right here on the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori. See you guys again very soon.